Let's just give it a few. All right, we should be good.
Thank you, Keith. Good morning, everyone, and thank you for joining us for this research town hall at this auspicious moment in the University of Connecticut's history. Today, in the next hour, we're going to try to answer as many questions as we can that you may have about the reopening of research at the university, and anything that we can't answer today that we can get answers for by the end of the day, we will also post later on the website. Before I start, it's worth mentioning just some of the successes that the university has had during this whole COVID crisis, and they're considerable, and I'm incredibly proud of what the university's done. And it's worth taking stock as we are about to take this next important step. First of all, during the crisis, we've managed to continue research on COVID-related research and some human subjects research, and that's been ongoing consistently throughout the crisis, and successfully so. Others have continued to make headway on their research from home, and including writing new grant proposals. We completed, as you know, all of the courses online for the spring semester, and we were successful in doing that without canceling a single course, which is a remarkable achievement. And we've managed to keep 1,000 students in our dormitories safe and healthy and cared for throughout the rest of that spring semester. No small feat. And in stores, we did that without a single case of COVID virus. And in Stanford, we did that with a few cases, but containing any spread. So all of those are incredible successes. Now we're about to embark on an important next step. And this is a small and cautious step, but it's an important one because it's our first step back. It's our first step towards returning in person to the campuses and the people that we love, and to the full exploitation of our mission. So I want to emphasize a couple of things, especially in light of the governor's announcements and guidance on reopening. The first thing I want to emphasize is that all decisions we make on reopening are driven by the health and safety of our community, and that the governor's guidance is just that. It's a guidance and not a decision. People shouldn't read into the governor's message that on May 20th, everyone should come back to work. In fact, May 20th for most people looks just like May 19th. That said, over the weekend, we've managed to process a large number of requests from faculty to reopen their labs. And I want to give a shout out to some really heroic effort. Our staff from EHS to OVPR to facilities was working till 9 o'clock last night to get these requests evaluated. And we have 60 approved over the weekend now that will be reopening their research groups and their research labs. Thanks to the hard work of the faculty investigators in submitting their information, and thanks to the hard work of our staff to evaluate and make sure everything's in place. I want to anticipate a couple of questions before I turn it over to Radenka Merrick and the OVPR staff to answer your questions, and to talk a little bit about the process before they further answer questions. But the two things I wanted to anticipate, one is two questions I want to anticipate. One is, will the university provide protective equipment for labs? And so this has a two-part answer. I want to start by saying that the safety of each lab is the responsibility of the principal investigator of the lab and everyone in the lab. And that's just like before. Before COVID, in certain labs, if it were a laser lab, you had to wear goggles. In other labs, you had to wear lab coats, protective shoes. This is just like that, except there's an additional requirement of wearing masks and other types of protective equipment that prevent transmission of disease. So in that sense, it's no different. What is different, though, is some of the protective equipment may be in short supply. And in those cases, the university is fully committed to work with the labs and the principal investigators to bring the full force to bear of our procurement engine to get whatever facilities you need in order to be open safely. And to that point, procurement has already been in the process of securing protective equipment. And we think that we have enough that is not the rate limiting factor for the first phase of research operations. So just wanted to lay that out there. Second question is, will the university have zero tolerance on safety protocols? The answer is simply yes. We expect the labs will be good about complying with the requirements for safety. I don't expect any issue there, but it's important for us to be sure that we don't let anyone put individuals, public health, or a research enterprise at risk by not being compliant. So that's just as simple as that. So with that, I'm going to turn it over to Radenka Merrick and her team. They're going to explain a little bit about the process that we're using in reopening labs, and then take your questions. So with that, Radenka, it's all yours.
Thank you, President Katsouleas, and thank you, everybody. I want to, one more time, to thank all the faculty, students, and staff for heroic effort to teaching online. But besides of that, I want to also emphasize the great work of our graduate students in helping faculty to teach online, in doing all assessment, as well as writing manuscripts and papers. I want to acknowledge the sponsorship group that worked so hard with the faculty to submit many of the grants in the last moments. And I want to say something that our dear colleague, Michael Lynch, who is director of Humanities Institute, was writing in his proposal. And he says, today we are fighting two viruses. One is real COVID-19. The other one is also real. It's a fear, it's miscommunication and misinformations. And he submitted the grant. So this is unprecedented time where we have opportunity for science to play the key role as well as humanity. And I want to finish with that notes that both humanities and science are going to get us out of this crisis. In advance of this town hall meeting, we received over 120 questions. I want to acknowledge OVPR office and HR, facility, provost office, everybody who worked day and night to answer as many questions as possible. We also asked the faculty to provide us the feedback on the first town hall meeting. And sometimes they will say, yeah, there are a lot of information, but they are always not clear. And it's not easy to communicate as these environments are changing daily. So some fundamental questions have not been clearly answered, and we are going to try to answer them today. But one faculty shared perspective that the whole issue of reopening is such a gigantic undertake, like the opening of the new store, and the task is enormous. And I want to thank everybody who participated in this enormous task. Since Friday, we received over 100 requests for the phase 2 opening, and we are now going to start answering your questions. So thank you all.
So I think the baton passes to me to do a brief introduction on process. This is Wesley Byerly. We are, as has been alluded to in the opening comments by the President, working on a phased ramp up of returning to research activities that will start May the 20th. The process is going to be familiar to most who have worked with this since we began dealing with maintenance of critical research infrastructure. The need will be to have a safety plan that is developed specific for the lab or research area and that can be applied going forward. That will be submitted and approved. There also will be the need to have PPE that is necessary either for general purposes around COVID or for specific purposes related to the research available. We'll get into more details around this with the questions. Everyone will need to have completed training. We have an online training module that was developed by EH&S, and just as a quick aside, has been picked up by the CITI program, which is a national, probably the largest used program for research compliance and research safety training. So we really have stood out in that regard nationally. And great thanks to Terry Dominguez and her group around that. You will get, once we have worked, as we work through our submissions, people will get an approval from the OVPR, and that's the green light to begin to move in. Again, as everybody has pointed out, this is not a rush in of everybody on the 20th. We're going to phase folks in. We have a lot of folks, that, as Dr. Katsouleas has alluded to, the continued work, so we have some experience on this, but we're bringing everybody back in safely and in an orderly manner. We'll have a dashboard up that provides information about where the submissions are in terms of process, so that people will be able to keep track of where we are moving folks in through this. The goal is to review incoming material and to ramp up our labs as safely as we can, but with an eye towards doing this over days and weeks and not weeks and months. I think we are all hopeful that we can have an ordered, gauged and quick return to research activities. And I think with that, we're going to go over to questions and answers, so I'll pass it back to our moderators.
Okay, so we'll be going back and forth questions, the OVPR email and live questions. The first question is for facility. What is the cleaning schedule and waste disposal? Who is responsible, and what is the availability of cleaning supplies?
So the cleaning schedules will be twice a day. We will be doing extra cleaning to touch points, disinfecting to touch points, door handles, push buttons, the like. That also includes bathrooms, and trash will be removed once a day.
Okay. Mike, for one more on cleaning schedule. And what is the protocol for using the bathroom?
So bathrooms too will be cleaned and disinfected twice a day. We are looking at 2 different options for notifying people when we clean. One will be technology. A QR code can be put on the wall. We can scan it and then have some kind of notification go out via technology, or very simple older technology. We may just put a little whiteboard in the room and just have the person write the time. Both of those are being evaluated right now.
Will there be free on-campus COVID testing or available, or at least a pharmacy, Coventry CVS?
This is Scott Jordan. At this time, we are not planning for on-campus testing. We are following the governor's guidance with regard to reopening of businesses for this part of UConn's activity, and that does not call for on-campus testing. It is something that we are looking at potentially going forward as we think about the fall and return of students. It is one of the gating conditions for full reopening of the campus to have adequate testing capacity. But at this time, we are not planning to offer on-campus testing. If you feel you should get a test, then you should coordinate that through your primary care physician.
This is a question for Wesley, and I'm sorry if I'm choppy. I'm not really sure how to fix it right now. Hopefully get better. Wesley, does each lab have to develop their own plan, or will there be one set of rules for all offices?
You need to unmute to Wes. Wes, you need to.
So in regard to developing plans, yes, each lab needs to have a safety plan that is submitted to the OVPR and approved. Their safety plan, COVID-19 safety plan template provides suggestions and additional guidance that labs can use in developing the safety plan. We would also encourage that as safety plans are developed, that the labs work together with everyone in the lab to pull these together, particularly working with the graduate students and folks that are most directly involved with the work. The research areas are really too varied to be able to come out with a one-size-fits-all type of plan. And so we're looking for the research areas to provide their understanding of what works for their areas, addressing the needs and guidance that we have out in the safety plan. And just as an example, safety plans for field research you would expect would be just vastly different than safety plans that would work around a small lab located in one of the campuses.
Okay, what is to research labs? We may need someone to repair or maintain instruments.
This is Scott Jordan. I'm going to look towards facilities on this one. Our policy will be the same as it currently is. There are facilities operations and maintenance and repair happening on campus now. We do have a protocol for vendors to maintain social distance. We do know that that, for example, on some of our construction projects, we have had some positives, and so we have a protocol in place to make sure that vendors that are on our campus are maintaining safety and informing us of who's on campus and whether or not, and when there's a positive test, we have a protocol in place to know about that and to treat it similar to any other workplace on campus, to close it down, deep clean it, and not allow people back until we're confident. But when you have a vendor on campus, you should make sure that Back Ops knows about it, and that you're keeping a log as if you would your own employees in your lab as to who's there and that they're maintaining proper physical distance.
Okay. And next question, I'm sorry. The next question is for Wesley. What training will be provided to ensure that students and staff who are returning to work are aware?
So in regards to ensuring people are aware of safety protocols, the safety plan requires everyone to receive training prior to returning to campus. There's online training, and as with the procedure for other safety protocols, the requirement is that the individuals review the safety plan and document that they have read and understand that. The PI or their designees responsible for confirming training before employees return to work. And there should be a retained copy of the online training for each individual.
Also for Wesley, what health screening measures are being adopted to ensure that research to return to the lab?
So I think, Jesse, let me try to read the questions. Am I coming in clearer to folks? Okay, so why don't we start there? Let me see if I can pull. How is UConn planning on enforcing? How is UConn planning on enforcing people wearing the proper PPEs?
So let me jump in and grab that one then. The requirements to wear PPE, in addition to just the requirements for safety plans, falls to individuals to reach out to those who are supposed to be wearing PPE, that they need to be have the proper PPE, that the PI lab manager or lab directors and PIs need to set that example by wearing PPE. EH&S will also be circulating in the labs, checking on safety plans and that we have compliance with individuals working and appropriately wearing PPE, as will the business managers. And we're going to tap into that group to also help ensure that we have folks following what needs to be done and appropriate. As the president said, there's zero tolerance for folks not following the requirements, and individuals who are not wearing appropriate PPE should not be in the labs until they take that seriously and have their PPE on.
An additional follow-up to that is that if there are people entering campus without proper PPE and without OVPR permission, how will this be controlled? And will these individuals be reprimanded? What exactly does zero tolerance mean unless you act? I can answer this a little bit if that's okay. So we are going to have a process in place where we're going to start with the PIs. The PIs are really the individuals who are most responsible for making sure the individuals in their labs are following the safety protocols. We will also have building managers, facilities, and EH&S going through and monitoring as well. But it's going to be really important for us as a community, as faculty, to really place this as a community level investment. All of us at the end of the day, just like the coronavirus, what the virus does is not just impact you as an individual, but all those that you have contact with. And if we don't ensure that all of us are following the guidance, the safety measures that are in place, it's going to have an impact not just on those individual labs, but on all labs for the rest of the university. And the price to have to shut down again is going to be pretty severe. So we are asking all of us to treat this as a community effort. No one will be allowed access into labs if they're not using the appropriate PPE and protective equipment. And we ask that we police each other to some degree, in indicating when we see people that are not complying. And if necessary, individuals will be prohibited from going to labs, and if necessary, labs will be shut down. We would like to not be able to not have to do that. So I think that if we can do this together as a community, we can assure that a safe return to the campus. Another question is, how are core facilities with shared lab spaces going to be able to operate?
So I think that one comes back to me. The core facilities are up and running. They are running on a process of having people sign in or schedule so that they can make sure that they're addressing having the minimum number of people in the area. possible, that they're decreasing density and allowing for appropriate distancing. So they have their own specific plans in place to ensure that there is separation, but that is really starts with making sure that if you're using core facilities, that you contact the core director, and schedule with them coming into the core and being able to use those facilities. And they'll work with you to do that. They have a schedule, as with the labs, to make sure that between uses there's appropriate cleaning and disinfecting like that. So they are expected to be up and working like every place because of the need to distance and make sure that we have lower density. The volume of work that they'll be able to move through is going to be a little bit slower, but I believe they will be able to hit their stride and really have appropriate volume taken care of pretty shortly.
Is one safety plan required per PI, or can safety plans include multiple PIs who share the same space?
If there is, this is Wesley, if there is shared space where a single safety plan can be used and makes sense, then yes, that could be, that we could have a plan that encompasses multiple PIs in the same area. If that's coming in, we need to make sure, that everybody has worked together to put this in place so that it addresses everybody's needs across all the shared space. That includes not only at the PI level, but also the expectation that folks have worked with the graduate students and everybody in that lab to make sure that this all works.
If I did not hear back from the VPR concerning my request to open, does that mean my plan was rejected, or they have not gotten to it?
If you've not heard back, that means we've not gotten there yet. We've got a number of these in the queue for pilot and limited research activities that have come in over the past 2 weeks. We have a probably 7 to 10 day backlog on those. We're now working to transition folks over to the ramp up research process. Those are starting to be reviewed, and people will begin to hear what to do on May the 20th over the next couple of days.
How do we request PPE if we are at a regional campus research lab?
So I'll differentiate a little bit on the PPE. So we will have masks in the warehouse, and if you're on a regional campus, we can send the masks to the building managers at the regional campuses. All other PPE within your lab that's necessary for your science will be purchased or procured the same way as normal.
I'm going to go to some of the pre-submitted questions as well. What can some areas do to maintain physical distancing?
The COVID-19 safety plan has some bullet points for folks to consider around maintaining physical distancing, and as does other resources from both the state and CDC. Considerations around things such as shift and flex scheduling. Shift scheduling and flex scheduling would allow physical distancing. Adjusting maximum occupancy of spaces would be a way to address physical distancing. Working on staggered seating so that people are not, for instance, sitting directly across from each other in lab benches, another way. And also then barriers, such as putting up plexiglass or physical barriers between work areas is another way to help maintain appropriate physical distancing.
Some students have been told by their PI to continue going into lab during the research shutdown. What systems are currently in place that can hold PIs accountable for the mistreatment of students?
So this is Kent Holsinger. I presume that it refers primarily to graduate students. And the resources available would be, first, you could talk to anybody at the graduate school about your concerns, and we will work with you to address them. The graduate school, however, may not be able to do so confidentially. If you want confidential advice, you can talk to the university ombuds. And then if there is, in fact, a serious problem that could represent a university policy violation, you may report that through the anonymous report line.
Can you provide a sample lab reopening request that you have approved so that we have a good sense of what you're looking for?
We will work to post some examples on the website. So yes, we'll get out some examples.
Is EH&S Consulting conducting lab safety audits for new labs at this time?
This is Terry Dominguez from Environmental Health and Safety. So EHS is prepared to support research. We will be present in the buildings conducting, as we have been during the critical research infrastructure phase, to support any waste pickups and calls for assistance as needed. We are going to be starting some COVID inspections to make sure that folks can safely come back to their labs from that aspect. So we will be again adjusting our presence as the population expands.
Can we prop open doors when there are no touchless options for opening them?
So in regards to, maybe I'll take a start, and then I'll let EH&S or facilities weigh in. Doors that have automatic closures on them are meant to be closed. In general, they're in place for fire code and safety purposes. So it would not be appropriate to be propping open doors that have automatic closures on them.
This is Hans Reinhardt. If there's a question regarding whether a door can be propped and how it relates to fire code, our fire marshal's office can come out and do an on-site inspection to provide additional guidance on whether the door can be propped or not.
In there's doors are there for security purposes, doors are there for fire purposes, but they're also there to partition a building from an HVAC perspective. So it will really depend on which door may be able to get propped. But in most cases, especially if we're over in the research areas, the doors are in the hallways, both are for fire, but also partitioning for HVAC and air quality.
What should I do if someone in my lab tests positive for COVID-19?
This is Chris DeLello from HR. There's a number of protocols that are in place once an employee tests positive for COVID. First and foremost, we've we've instructed all employees who have tested positive to first worry about their health and well-being and contact their primary care physician, or they also can contact the COVID call center at UConn Health. And the number there is 679-3199 to help with any supplemental information that can provide them some guidance. Once that happens, we then ask the ill employee to contact, in this case, their principal investigator of their circumstances. The university protocols in place with the OVPR office should readily have information about who the employee has had direct contact with in the workplace. HR, once they are notified by the ill employee, notifies facility operations of the location of the work site and of the ill employee, and that lab or work location will be closed. Facilities will perform the approved cleaning protocol and will inform with EH&S, primarily in communicating with the principal investigator, when it's safe to have those employees who have not been in close contact to return to the work site. HR will work directly with the ill employee to ensure all of the appropriate pay and leave guidance we can achieve. And if an employee is ill, I want to emphasize no one is expected to continue working while they're ill. So we have a number of protocols in place for those employees who have been in close contact. They will be instructed to quarantine for 14 days. And if they're asymptomatic, they certainly can telecommute if that's at all possible. And, you know, as we work through this, we always want to achieve the privacy of the employee to the extent possible. I know some labs are small and small locations, but we do want to acknowledge that is a primary concern for all of us. Employees not in close contact, once the workplace has been cleared for work to resume, may return to the workplace upon notification first by the principal investigator.
Next question, I believe, will be for Rudenka. I'll try to sort of indicate who to address the questions to as an initial response, and then others can certainly join in. The pandemic is putting a financial strain on the university and on PIs who have seen their grant balances drained. What is the university doing to seek state or federal relief?
So thank you. So University Government Office, President Office, and DPR Office has been working with congressional leaders to encourage agencies to adopt a greater uniform implementation of the regulatory flexibility and provide the supplement funding to provide the cost extension as well as to recovery due to the shutdown and reopening. So I will pass to President to talk a little more about the Heroic Act and where it is now. But my understanding is now that it is at the Senator floor. So if President Katsouleas can tell us a little more from update that he has from government office.
Yeah, that's correct, Rudenka, that we've been working very hard with our representatives. The HEROES Act has passed the House. It has about $90 billion in it for higher education, and it has gone to the Senate. The Senate has not indicated an interest in taking it up at this time. So, but there has been, Mitch McConnell has said that they see a need for it at some point in time. So the best guess is something in the midsummer time period before this actually comes to fruition, but we'll keep working on it.
This is another PPE question. How will labs be able to get PPE and who will pay for it? Wesley, would you like to start with that one, or Scott?
This is Scott, and Mike Jednick may jump in and Wesley may jump in and help me finish the answer. But PPE, especially those PPE that are scarce, starting with masks and, well, not exactly PPE, but also hand sanitizer and that sort of thing. The items that people are having a very hard time procuring on their own, we are making an institutional effort to centrally procure as much of those materials as possible. And we now have masks, adequate masks in the warehouse, and many more on the way. We've thanks to our folks in our supply chain office, we've been able to secure two full pallets of hand sanitizer. They haven't arrived yet, but that's more than 5,000 bottles that are on the way. And so those items we will manage centrally. And when if you go right now to the central warehouse website, there's an order form for masks. We are also paying for them centrally. The last thing we want is to have artificial shortages on campus due to budgetary restrictions within individual departments. So you will not be charged for the PPE that you receive from the central warehouse at this time. Specialized PPE that you may need for your laboratory and those that are not scarce, you should procure in the normal way through your KFS and Husky Buy processes, and you will be charged for those. N95 masks, although I'm not sure that there are any folks on campus who need them outside of the healthcare field, we're procuring those through the state has maintained a stockpile of those, and they're scarce. But if you need them, you should contact facilities, and we'll work through the emergency management process to get what you need there. The process for ordering those centrally maintained PPE is through the central warehouse. And there, as I said, there's a website where you can order them. You may be understand that may be frustrating to some folks, but as of right now, the rule for disposable PPE or disposable masks is that we're issuing 5 per person. So when you're placing your order, please understand that we will give you 5 disposable masks per person. That is designed under CDC guidance to have 1 per day, which gives each mask a full week to recover. As these things become more plentiful, of course, we may change these rationing requirements, but at this time, we're rationing those items. I hope I answered the question fully. I know that was a long one.
This is Mike Jednak. That's correct, Scott.
Thanks.
We've also received a number of questions regarding testing and why the university is not requiring testing.
This is Hans. Currently, the governor's reopening guidelines do not require testing for any of the businesses or what they refer to as phase 1 reopening of Connecticut beginning on May 20th. Part of the governor's higher ed recommendations for the opening of fall is a testing component, and we are working on meeting those guidelines. But currently, the governor's guidelines do not require testing for opening on May 20th for any business, including reopening of research at UConn.
This question will be for Mike Glasgow. When do I need to submit my proposals to SPS for review and submission? Mike, you are muted.
I could tell I was muted. Thanks for the question. So we've sent a couple of announcements out or in the FAQs about proposal deadlines since we started remote working. Our standard deadline is 5 days before the sponsor deadline. It needs to come into sponsor programs. That's everything but the science. As an interim step, trying to decompress the volume that comes in on the deadline, we also said that proposals that came in at least 48 hours before the deadline, or 9 a.m. if the deadline's at 5 p.m., would be prioritized to make over other proposals that were in-house to make the deadline. Again, we asked for all the final science to come in at least 4 hours before the deadline. So the good news is a lot of people are submitting proposals. We just have a lot that are coming in toward the end that we want to make sure we get the proper review, support the faculty in reaching the deadline. So that's sort of the guidelines. 5 days in advance has been our kind of our longstanding practice. We haven't really enforced that in the past, and we're taking some interim steps to try to decompress it at the end with a request for 48 hours before.
When will undergraduates be allowed to return to research programs? And I can start with answering that question. As part of the phased process of reactivating research labs and research programs, we anticipate undergraduates will be able to return to research, but we're going to be doing it in a phased process. And so we will initially begin by prioritizing those projects that were already in the queue. We want to make sure that we've got our safety plans in place, our monitoring system in place, and that we're able to successfully sort of shift into resumption of research activities. At that point, we will then consider bringing undergraduates back on campus. So they will be included as part of the phase process, but not in the initial process and the initial phase. And we'll be providing additional guidance on when undergraduates will be able to return to engage in research. I believe this is a question for Wesley. How are requests prioritized, and can work that's done outdoors or in the field with minimal contact or staffing be given priority?
So prioritization is being looked at on a number of fronts. We're looking at when requests are coming in. We're looking at what the research is and how that impacts on the ability to easily ramp that research up and begin to get that research started. We're working also to look at making sure that we're not having too large a rush in any single building. So we are working hard to deal with a number of factors to prioritize research, to the return to research activities. Let me again try to assure people that we are going to move through these as quickly as we can to ensure that we are safely opening these projects with a goal of getting labs back to resuming their research activities in as quick a period as we can. Again, looking over days and weeks, not weeks and months.
What health screening measures are being adopted to ensure the safety of researchers returning to the labs? And are electronic signatures okay for the PI signing daily logs? Wesley?
I think those come back to me again in that. So the governor's guidelines on reopening offices puts in place a sign-in log, sign-out log to make sure that we understand who is on premise. So that is being implemented as a requirement for the opening of all the labs, and part of that is having people signing in, review the symptoms of COVID, and assuring them that they are not experiencing symptoms before coming back. As was touched on in a previous question, individuals who are ill should not come to work. There's a process to follow in terms of what to do, follow that HR process, but I think a lot of what we're doing to ensure safety and to control COVID starts with, if you're ill, please don't come into campus, don't come to work. When you're here, wash your hands frequently and distance. If we do that, we have a lot in place to really help us move forward. So that's sort of our process around making sure that that we know who's here, and we have steps in place to make sure that people are well.
I have a medical situation that prevents me from wearing a mask or face covering, and I am not able to do my work from home. Are there any requirements or guidelines for those unable to wear a mask? Terry, would you
So
like
this
to
is-
start with this one?
Sure. Sure, this is Terry again. So going back to the Connecticut rules, so people need to wear masks to enter a university building. It's a requirement. If you're not able to wear a mask, then really you should get in touch with HR to provide some guidance on your particular situation. So that would be for that individual. With regard to wearing a mask within the building, and in the laboratory spaces, it's required in a laboratory space because that's considered a shared space. The Connecticut rules do allow for removal of the mask in a segregated singular office or cubicle where others would not be in. So that's the limited exception to that. So in general, face masks or a cloth face covering would be required.
And this is Crystal Ello in HR. And HR is ready and poised to assist those employees who feel at this present time they cannot wear a mask.
So there was an additional question around electronic signatures. Electronic signatures are legal in all states of the U.S. and in the U.S. And have been for years in Connecticut. And so I can sort of respond to this one in terms of why we are requiring wet signatures for the daily logins. This is going to be a weekly verification and certification by the PIs or the PI's designee. And one of the reasons to do this is to ensure that the PIs, because you're ultimately responsible for the members of your lab following the safety protocols, we want to make sure that the PIs are able to physically be present in the labs to engage with their staff and to ensure the safety protocols are being met. And to do that in real time by coming in and seeing the lab and making sure people are following the protocols. So as we begin the ramp-up process and reactivation of labs, we want to make sure that we have multiple touch points, and our PIs are our primary resource to ensure that that happens. So that is the reason why we are requiring wet signatures for the weekly verification of the daily logs rather than electronic at this time. This is another question. Can someone address if and when campus will determine mask-required zones within UConn buildings, or whether these decisions will be made at the dean or department head level, or is 6 feet all we need?
Could I maybe weigh in on that again, just to, I guess, be clear that the default is mask or cloth face covering. And the exception is your private office or a private cubicle with walls where other people would not be entering. I can give a little rationale to that. So, if that's okay. So just imagine that, the purpose of the mask is to protect others, right? So even if you're not in that same space, you might be shedding some respiratory droplets in that area. So now we have surfaces that could be impacted, and maybe you're not there, but half an hour from then, another person shows up in that space, and it might have been cleaned, but yet there was a person who might have passed through there without a mask, and now we have a concern. So again, the default is wear the mask or cloth face covering.
And this, I believe, is a sponsor programs question. Is there any guidance to help PIs who are at the mercy of individual companies for funding extensions, for funding or extensions?
Contracts team. Specifically, you could reach out to the director, Mark Reeves, for assistance. We'll add this guidance to the website too, so that you can easily get to Mark.
If a PI is older and does not want to come in, Does this mean no grad students can be approved to come into work?
Maybe I'll take a initial stab at it and then pass it over to Chris. If a PI feels that they are in a situation where it would not be appropriate for them to come in, they should work with HR first on their individual situation. In terms of verification around the logs, then they would need to have a delegate who was going to serve in that capacity for them. So there needs to be a clear delegation of somebody who's going to take on those responsibilities of making sure that the safety plans are being followed in those labs. And Chris, let me maybe pass that to you to see if you have anything else that you want to add in on that.
I think that the delicate approach is exactly what you said, Wes. We understand, we're all working in the direction of our fear, and, the goal is to reduce community transmission. With respect to HR, we've always encouraged employees and managers to really explore the boundaries of creativity when it comes to telecommuting or flex or rotational schedules that ensure the employee's safety to the greatest extent possible. This afternoon or later tonight, there'll be FAQs on the website that address this specific question for employees. And, an employee, to the extent possible with their primary function, can explore a flexible assignment with their manager and human resources to hopefully address the needs of the role. We also respect that there will be employees who won't be able to work through that reassignment, and they can request their accrued leave time and can work with HR to affect those things.
We have a question regarding tip companies. Do all these policies apply to the companies in the technology incubator program? Wesley?
Yeah, Michelle, yes. Policies for the university apply to the tip companies. The tip companies are also independent companies and may have policies that are unique to them. But in terms of where we are moving with the COVID process, the tip companies would be expected to follow university requirements for the shared space or the university space through which their employees might need to transit. And we are also requiring that the tip companies have a safety plan that they develop for their companies, and are asking that those are submitted to the OVPR through our return to research process.
So I believe we are about 2 minutes from the 12 o'clock stop time, and I just wanted to, if there were any closing remarks that either Dr. Merrick or President Katsouleas would like to make.
Michelle, if I can, I would like to thank everybody who worked so hard to participate and answer all those questions. And I want to thank President, and this is the process. And if we didn't answer something, please feel free to reach to our office, and we will post on frequently asked questions. So any point that you can give us suggestion how to improve communication, we are going to be open to your feedback, and stay safe.
Let me just add my thanks to the audience for your excellent questions, and especially to the panelists for their very thoughtful answers. I think you could hear how much thought's gone into this and what the emphasis is on health and safety, and I couldn't appreciate that more. I want to wish everyone great success in returning successfully, but most important, safely, and wish you all well. So thank you very much for attending today.